So we do have one more case in South Australia to report, and this is a case indeed linked to the Parafield cluster, but fortunately this person has been in quarantine since early last week and in fact has already had 2 negative tests. So she is part of the extended family group and had been part of a family gathering, but she has been in quarantine since Monday, and as I said, she's already returned 2 negative tests and has just been re-swabbed because we are re-swabbing all of the close contacts, and we had an early morning result this morning that was positive. And it's rather interesting, I suppose, for people to be thinking what was the incubation period. So when I was quickly calculating this, it looks like that's been about 8 days. So many people have had shorter incubation periods with this particular genomic clone of or strain of this virus, but this person had a longer incubation period, and it absolutely tells us that anybody who's been asked to be in quarantine needs to be in quarantine for the whole 14 days, because there are people that have that very much longer incubation period, and certainly getting out to day 8 is quite a long period of time, but obviously the 14 days is of major importance for everybody who's been asked to be in quarantine. So in terms of our total statistics, there are 27 cases now linked to this cluster. We still have just one person hospitalised, and that's a person in his 30s, and he is stable, fortunately. But everybody else remain relatively well. We have obviously our cases in Medi hotels, and then many close contacts. There are some close contacts in Medi hotels, but the majority of people in quarantine are quarantining at home. We continue to contact all of those people in quarantine, and there's now well over 4,000. And we also, of course, are talking to people who live with them. And I just thought it was also useful to explain that we don't just do one interview with people who are close contacts. We actually continue to keep in contact and continue to re-interview. And on the basis of that, there are sometimes decisions made to add additional places of interest to our website. So one of the things I'd like every South Australian to do is to look at our website on a daily basis. You know, check the weather first, work out what you're going to wear, but then check our website to see if there are any sites of interest that we're putting up there, areas of concern, and please follow the instructions. And I was just talking to our comms team about trying to make sure that the new information is put right up the top so it's easily read for people. So in terms of our cases and testing stats, we've now got 38 active cases and 556 total cases. And as the Premier said, we had a very, very good result with testing, almost 9,000 yesterday, which is pretty good for a Sunday and is quite reassuring for me. But we need to maintain that testing. And if we don't have approximately, 8 to 9,000 per day, we're not going to be picking up community transmission. And there's mathematics behind that, but we know that we have to get everybody with symptoms, and it's not just in the north of Adelaide or not just in metropolitan Adelaide, but it is the whole of South Australia. And we've been surveying our population every week since the beginning of COVID and asking people whether they have respiratory symptoms and indeed whether they're getting tested. And for quite a long time, it was only about 10 to 13%, so a very small number of people with respiratory symptoms who were getting tested. But this is the time, if there is any time in this pandemic, for anybody with even mild respiratory symptoms to get tested. We had that fabulous Dr. Darmani, and I do thank her sincerely, who thought and heard the cough and got the swab done. But we need all of our doctors to be thinking and testing, but we also need every South Australian to come to a clinic. We've got a very good system now, lots of testing sites, so you shouldn't have any problems getting tested, and an extremely good turnaround time, so you'll be SMS'd when your result is through. So that's the first message really for this week. It is a critical week, this week and probably the week after, to have that high index of alertness about your own body and about your symptoms. But the other thing is we are not out of the woods yet. If we have had any community transmission, we will start to see it this week. And that's the reason why we're urging every South Australian to be wearing a face mask. It can be a disposable one, or the cloth masks are absolutely fine as well. Because that means if and when we do have another case, we will be able to do a risk assessment and work out who needs to go into quarantine, but also it has the potential to cut off that ongoing chain of transmission. It not only protects you, the face mask, but it protects the whole community. So when you put a face mask on and you think, well, gee, this looks a bit silly, or I feel a bit out of place, or it's a bit uncomfortable, you're protecting your own health, but you're also protecting the health of your family and your close friends, but also of the whole South Australian community. Now, we are looking at ways of trying to make the disposable face mask more readily available, and some of my team have been working with local government and other organisations to just try and make sure that everybody has a mask and they're accessible. Particularly some of the places that I was thinking about over the weekend where it would be useful to wear a mask are when you're out in the shops and you're going to be closer to people, and also the large shopping centres you know, particularly those large busy shopping centres where you've got multiple shops. Have a mask in your pocket and pop it on when you go inside, and I'm sure the people who are serving you in the shops will be most grateful that you're wearing one.